Greetings, I'm Yvonne Stapp for Science for the Public, and I welcome you to Contemporary Science Issues and Innovations. As you know, climate change is affecting life and environments everywhere, and the medical community is increasingly concerned with the diverse effects of climate change on health. Our guest today is a leader in addressing those concerns. Dr. Gaurav Basu is a primary physician and co-director of the Center for Health Equity Education and Advocacy at Cambridge Health Alliance, and he also teaches at Harvard Medical School. Dr. Basu has developed curriculum and training innovations for preparation of medical students for the numerous health issues related to climate change. Today, he will discuss those health challenges and how he and his colleagues are training physicians to diagnose and treat novel medical conditions associated with climate change. We are very pleased to welcome Dr. Gaurav Basu. Welcome, sir.
Thank you so much for having me, and it's an honor to speak to you all.
And I would like to begin by asking, well, first of all, to just mention, as you are aware, that for years, people have warned that there would be medical conditions accompanying climate change. And now it's quite upon us. But you have taken the initiative of really developing training for physicians in this kind of new generation with these new concerns. So what kinds of issues, or I should say, what kinds of health issues have you observed in medicine related to this climate change, please?
Yeah, thanks so much for the question. So I think climate change, I believe, is the greatest threat we've ever known to human health. That's a big statement, I know. And it's also part of the challenge, I think, of climate change is it's hard to, for the general public, I think, sometimes to understand how does it impact me. So as a physician, I have many colleagues, many friends who say, oh, I didn't really think a physician would be involved in climate change work, which is a surprise to me because I do think of climate change as fundamentally an issue of health and of health equity, of fairness, and making sure that the most impoverished and under-resourced communities around the world are being disproportionately impacted, and I think we have to have that in mind when we're thinking about solutions. So for me, as a physician, I think of my role a lot in doing the translational work, making it more clear to the general public and to our trainees, our medical students, our residents, how climate change is a threat to everything we care about in regards to health. And I think that can make it more clear and make the stakes more clear to people and why we need to do everything we can to work with depth and urgency and clarity of conviction to do this. So climate change impacts it impacts nearly everything. So it's I could say that it touches all the kind of work I do, but I'll tell you kind of how I start by thinking about it, maybe as a beginning way to frame the issue.
Especially the conditions that you've observed that you would say are related, if we could get that.
Yeah, absolutely. So the first, so I think number one of the natural disasters that impact displacement, that cause mental health trauma, that causes people to be away from their medications and homes and all the various things that happen from natural disasters. I think about food insecurity. I think about water scarcity, infectious disease, heat-related diseases, a whole bucket of many issues that we can talk about, respiratory diseases, mental health, and then also I think a lot about this kind of forced migration, political conflict element and how that interfaces with health as well.
Right.
So I could talk about, each one of those has, numerous diseases. Maybe I'll start by describing one of my patients that recently spoke to NPR, a patient of mine, and we spoke together for an NPR piece about a West Nile virus encephalitis infection that he had. And so, this happened right in Massachusetts, and West Nile is not a disease that we think a lot about in Massachusetts. It's a mosquito-borne illness. And what we know is that mosquitoes really like warm temperatures. And so as the planet warms and the geographical distribution of warm temperature and weather patterns change, we are expecting to see more and more frequency of mosquito-borne diseases, not just West Nile, but things like malaria and dengue and things like that. And
Yes.
so that's a good example of a condition that, you know, we weren't teaching our residents and
Mhm.
students to have on their radar when they were diagnosing someone with the symptoms that this patient came in to the hospital with. But we have to be doing a much better job of doing
And Dr. Basu, if I can just clarify
that.
something, I think most people are not aware of the effects of West Nile. So in that case, I think the patient was affected for quite a long while.
Yeah,
Correct. And that
this was a really tough
doctors
case.
might not know what that is.
Yeah, let me describe this a little bit more then. So West Nile is, you know, it's a virus that is mosquito borne. For this patient, you know, it was it went into the fluid around his brain and spine. And so you know, the presentation was with fever and with disorientation and slowly like not even being able to speak and things like that. So there's kind of a broad range of symptomatology and presentation. Some are more mild cases. But certainly, you know, it can be a pretty severe course. And for this patient, it
Mm.
took a year to recover and
Wow.
you know, really impacted ability to walk, ability to get back to work, you know, really the basic functionings of life.
Dr. Basu, could you tell us what West Nile is like for patients? I don't know that we're all familiar with that.
Sure. Yeah. So it has a wide range of presentations for sure. For some patients have mild symptoms and don't have a dramatic case. But for the case of my patient, he did. And a lot of it is because the infection had found its way into the fluid around his brain and spine. And so for him, there was, you know, significant fever, disorientation, and then, you know, to the point where he was not able to speak and became very we call altered mental status. He's not his cognition was not clear. And so, you know, there's, you know, broad symptoms like fevers, myalgias, muscle aches. But, you know, in my patient's case, you know, really took a long time to recover. And basic functionings like walking properly, reading, getting back to work, you know, took up to a year. So it's something that we got to, you know, be very clear-minded. You know, malaria is something in a global perspective we think a lot about and has caused significant mortality for particularly, you know, young children. So we've got to be clear-eyed about the fact that climate change really changes the distribution of these diseases. You know, we're all thinking about infectious diseases right now because of COVID, and
Yes.
you know, we've got to think about the way climate change changes, where infectious diseases have the opportunity to thrive.
Yes, and just on that, as a matter of fact, the worst effects, as far as I know, are predicted to be in the poorest areas of the world. You know, or it is a very significant
Yeah.
percentage will be in very poor areas where people cannot escape too easily, and they are going to be confronted with bad water and bad climate and food shortage and all sorts of things. And I would like to ask you, if first of all, if that's generally the case, and also that kind of stress, does that amplify the conditions that are associated with climate change illness?
Yeah, I'm glad you asked the question because that's you know, that's a lot of what I think about is the
Mm,
way in which communities that are already under resourced and really trying to survive through really challenging circumstances already. Climate change puts a profound threat and a profound strain on those communities. Again, maybe I'll give you a quick example, and this is one
yes,
from kind of my family history. Is my family's from West Bengal, India. And earlier this year, there was a major cyclone called Cyclone Amphan
yes,
that decimated Bangladesh and West Bengal, the coastal areas around the Bay of Bengal. That cyclone happened in the same week that the National Proceedings of the Academy of Sciences put out a new study showing the ways in which climate change makes these very intense cyclones, hurricanes
yeah,
more frequent. And so, you know, Cyclone Amphan was if not the most, one of the strongest hurricanes to ever come through that region of the Bay and
Mhm.
Bengal. And we could see the real impacts of how it really, it ransacked these village communities. And that was happening in the same week in which there was a surge of COVID cases.
Mhm.
And so, an organization I work with there, we're really describing the scene in which people were running away to emergency shelters to get away from this hurricane, and sitting in the shelter worrying about the risks of transmitting COVID, within the shelter. And so again, I think a lot about these natural disasters. I think a lot about food and water, being really the foundations of our health. And I can explain a bit more if it's useful how climate change threatens our water supplies and our food
Yes,
stability.
yes,
But I really think about the kind of foundations of our health, and already we've got to understand that hundreds of millions of people are suffering from malnutrition and have already, threats to water supplies as it is, and climate change will make all of that worse. And so it really kind of turbocharges a lot of the inequities that we already see and make a lot of the kind of problematic inequities worse.
Dr. Basu, in addition to these horrible dislocations that uh, kind of increase the bad situations for people, their already existing health conditions, and the malnutrition and the lack of decent water and so on, these kinds of new weather patterns that we're seeing everywhere now, including here in the United States, with an increased hurricane season, do they introduce new diseases as well?
Well, so the intersection of these natural disasters and health are clear, right? So
Yes,
when I'm describing what happened in Cyclone Amphan in West
yes,
Bengal, the hurricanes bring with it, flooding that bring a lot of waterborne diseases,
yes,
a risk of waterborne diseases, displacement, um, and so certainly there's major implications of these natural disasters. We think a lot about drought also, right? So on the
yes,
flip side, a problem with climate change often is it's displacing water through hurricanes and things like that, and in a lot of ways bringing too much water some places, not enough water other places. And so again, I really think about the kind of foundations of health, and that is kind of clean water supplies, stable food systems. Climate change itself can change. So if it gets too hot in some areas, then we get concerned that the food cannot grow in the way that it used to be in
yes,
that area,
yes,
and also that carbon dioxide levels can change the nutritional value of the food, so that there's not as much protein and vitamins and things like that. So it's I think with climate change, one thing that's important to just recognize is it's all connected. It's all
yes,
interconnected, and that health and disease is right in the middle of all of it. And that if we are going to be mitigating these natural disasters, we've got to have health in our mind, because it's really, in my mind, when I picture these coastal poor communities and they're running away from natural disasters, right now in the midst of a pandemic, in my mind, as a parent, I and as a physician, I just, my strong reaction is that's not right. That's not fair that little children would be put
right,
in the middle of these threats. And particularly, I want to make the point that it's well studied, well understood, that these poor communities are not the ones that are emitting all these greenhouse gas.
that's right. Thank you.
So dramatically disproportionately, United
Yes,
States, developed countries are
absolutely.
driving cars, eating, red meat, using a lot of electricity and energy that emit carbon dioxide and other greenhouse gas emissions. These communities that are so dramatically disproportionately being impacted are not doing that
Right,
to
right,
nearly the same amount. And
right.
so that's why a lot of times I do anchor this conversation in a conversation about fairness, and it's not fair
Yes,
that people would get sick in this way.
right.
One other example maybe I can just share is the example of air pollution. And so that's one that we've got to think a lot about in the United States as well, is that a lot of our fossil fuel infrastructure and a lot of the polluting kind of energy systems, a lot of times the freeways, the way that they're located, disproportionately cause air pollution in communities of color. So this notion of environmental justice is really an important framework, that communities of color and poor communities should not be bearing the burden of this fossil fuel infrastructure disproportionately. And that is what is happening. And this air pollution
Yes.
causes increased heart attacks, respiratory diseases.
Yes.
There's new studies showing that people who have
Asthma.
COVID, yeah, asthma, people who have COVID, it appears from preliminary studies that they're more likely to die from COVID if they've had
Yes.
long-term
Yes.
exposure
Yes.
to air pollution. So again, it's all interconnected, and we've got to kind of really create a new infrastructure so that people stay healthy and don't get sick.
Right. Thank you so much for underscoring that relationship between the who's doing this
Yeah.
the disproportionate damage and who's on the receiving end of that damage, and also for pointing out that we are endangering a whole new generation. So parents today should be deeply concerned.
Yep.
Now, on that, you have taken a lot of the initiative for changing the medical training. Could you tell us how that works? What have you
Yeah.
done? I know you created courses and so on, and people are requiring this, or I should say, be requesting this.
Yeah.
To please explain your innovations.
Well, what I'll start by saying is that, students and residents, there's a hunger for this. And so I
Yeah.
think, as is true with the general population, younger generations really understand this in a
Yes.
way in which I think they are leading the charge in a lot of ways. And
Mhm.
so the students are clear-eyed about the threat. They understand that in order to be good clinicians, to be good physicians, the whole purpose of this is to try to, people come into this work so that people will be healthy. And so
Yeah.
we can't close our eyes onto these broad threats that impact all these things we care about in medicine. So I really want to amplify how much energy has come into this work from the desire, of stated desire of students
Mhm.
and residents to really kind of change the way that we're teaching about this. And so I feel kind of a responsibility that we do this well. I think we have a long way to go in medicine. I think fields like public health are a little bit ahead of medicine, but
Yeah.
medicine is starting to get some recognition that, I guess basically my approach to medicine is that we've got to understand these structural and upstream factors that influence
Mhm.
people's health. And so
Mhm.
we understand if people don't have access to care, if they have poor housing, if they don't have
Mhm.
access to
Mhm.
food, if they live in poverty, if they're exposed to racism. These are all things that
Mhm.
impact
Mhm.
people's health. And I think that physicians and clinicians have a really powerful opportunity to speak up about these things and say, hey, these are my patients, and I know that I can give them a medicine and help them with their health. But what I really want to do is speak to these things that are impacting, causing illness in the first place, and stop that from happening. And so that's a lot of the framework I use for climate change, is that we have got to understand the ways in which climate change is directly impacting our patients. And I tell residents sometimes it's important to be thinking about glaciers and to be thinking about, things that feel a little, far away. But I want them to be picturing their patients and to be really
Yes.
thinking of the ways in which some of these invisible greenhouse gas emissions, the way that the planet is slowly warming, is directly impacting their patients. And so some of the courses that we teach right now is to kind of explain, the real intersections between climate change and health, to make it very
Mhm.
concrete. People in medical school and residency are learning about these different health and disease processes. And so we want to put, this framework in place, and the ways in which climate change really kind of casts a die on all these issues and says, hey, listen, you are learning about asthma right now. Let me
Yeah.
tell you how particulate matter 2.5, a dangerous form of air pollution, will cause
Yes.
inflammation or oxidative stress in the lungs to make children have to go to the hospital more often. You're learning about infectious diseases. Let me explain to you why mosquitoes
Mhm.
are breeding for a longer season and can spread all these new diseases in new areas of the world. We're all thinking about COVID right now, and maybe I'll just
Yes.
say a quick word of some of the way we're trying to teach the overlap. You know, COVID probably would have happened, very likely would have happened without any influence from climate change. But what we know is that things like deforestation, cutting down all these forests, and us
Right.
encroaching into natural habitats put us in closer proximity to animals that have viruses that are dangerous.
That's right.
And we know that COVID started as it's a zoonotic disease. It was a virus that we believe started in bats and then slowly spilled over into the human population. And so I have a lot of concern that as we bring our interface closer to these animals, are the risk of future pandemics increase from that? There's some concern that bats migrated in Africa and because of deforestation, and that might have increased the risk of Ebola. And so there's a bigness to this, and we have to embrace, step back, and understand how
Right.
all these things are connected. But I think that's kind of my goal as an educator, is to allow students to step back and see how these broader threats are impacting the patient in front of them. And we have
Yes.
found that students really have embraced that work of saying,
Yeah.
I want to understand the big picture, I want to understand the structural issues, I want to understand how climate change is kind of creating an ecosystem that would allow for more disease, and I want to speak up for those threats, and I want to stop those threats, and that's most clearly burning fossil fuels, because that's impacting my patients. And so we do
Right.
a lot of it through case studies and kind of explaining how some of the risks of these diseases increases with climate change.
Two things. I really appreciate that the students are very receptive. They understand the big picture, and that secondly, that your course objective is to present the big picture. This is all goes together. We hear a lot of that increasingly in public health schools, but I haven't heard so much in medical schools. And so very quickly, I'm just going to ask you, do you come up with resistance? I noticed in the interview with the NPR, that's very interesting that
Yeah.
an executive in a medical school somewhere would challenge, well, say, oh, I don't think we should talk about climate change. That might offend the patients. It's the exact opposite to a lot of medical practitioners, I think.
Yeah.
What do you run into this kind of resistance?
Yeah, listen, things are changing, and certainly
Yes,
traditionally talking about these bigger issues, there is
yes,
there is a real emphasis and culture of thinking about the small. And so medicine
yes,
has a real tradition of doing molecular biology,
yes,
lab-based research, understanding the micro level. I think there's
yes,
many of us as educators and certainly as students and residents who say we also want to speak to the macro issues. And
yes,
there's just no, there's foundational, rich evidence of the ways in which climate change impacts health. It's being, in my mind, it's being a good doctor. It's me fighting for my patients, being worthy of the trust my patients put in me, for me to really understand climate change. Because if I want my patients to be healthy, I need to understand these broader threats, and I need to speak up for them. I need to explain them. I need to translate them, because for me, it's foundational to my professional responsibilities to understand these kind of macro issues. And
yes,
so, but certainly, I think there's right now, an evolution of how we teach a lot of these things, and I would say there's,
yes,
again, a real hunger for it. So
yes. I'm
I'm
glad to hear that.
optimistic it'll grow.
Yes, glad to hear that at least the students are really on board. I agree that I think the younger generation does understand these connections, and they are not reductionist in principle the way that so many sciences and medicine have trained people.
Yeah.
Now we're going to run out of time, and I want to ask you about the Center for Health Equity Education and Advocacy that you are co-director of. What do you do, please, in that?
Yeah, well,
What does that
it's a good
do?
segue from just our previous conversation, and that, at the heart of it is, again, as a doctor, I want to speak not only to health, but to health equity, and to recognize the ways in which so many communities are disproportionately impacted by
Yes,
all these structural issues. And so my experience as a student, as a resident, and as a faculty member was that when patients come into my clinical room and I know that I can change their medications and
yeah,
improve their diabetes or blood pressure to some measure with the medicines that I'm trained to provide, that gives me great joy to be able to be trained
mhm,
to do that. But I also have a reaction wanting to speak to that
yes,
structural level. And so where there's clear evidence in regards to social determinants of health, structural determinants of health, we know that issues like housing and poverty,
Mhm,
exposure to racism,
mhm,
fear of, of coming to clinic because of xenophobia or
mhm,
anti-immigrant sentiment.
mhm, mhm,
This is all a part of the ecosystem in which we work as clinicians. And we can either open our eyes to it and recognize that health and disease is created in society, is created in
mhm, mhm, mhm.
communities. It doesn't just kind of manifest when someone enters a healthcare system.
Right.
And so what my desire is to listen and understand the ways in which things are happening at the community level, at a policy level that will be impacting my patients. And I think that
Mhm,
clinicians have a really powerful voice in saying, hey, listen, I am seeing, we get the privilege of hearing people's stories. We get to have the
mhm,
privilege of hearing their joys, their tragedies, their
mhm, mhm,
successes, the ways that they get sick. We see it all. People really trust
mhm,
us to tell us all of that. And so in my mind, we have a responsibility to speak up and say, hey, I am seeing all these things impact my patients. And so
mhm,
we got to have a better housing policy. We've got to make sure that people have a living wage so that they're able to afford
mhm.
their medications and healthy food. And so the Center for Health Equity, Education, and Advocacy provides a bunch of different courses. There's like 6 or 7 that we're running now to really
Ah,
dive into these topics. And so we teach about, specific topics like climate change, access to healthcare, immigration,
mhm, mhm,
but then we also do skill building. How do you
mhm.
write op-eds? How do you speak at the State
Ah,
House?
great.
Um,
Yes,
how do you become an advocate? A lot of our students and trainees want to advocate for
yes,
their patients, but we don't have much space in our training to learn how to do some of those things. How do we still tell stories? How do we speak, clearly with media and on the radio, things like that. And so we have again found a real hunger among our students and residents to want to learn how to be able to advocate and learn some of those skill sets and develop a deeper knowledge base in a lot of these topics. And then we try
yes.
to mentor and support them so that they can develop a career in that field.
Yeah, right. That's very encouraging. That really is. The other thing attached to that is do the trainees of, I should say, medical students, do they, uh, or your organization go forward to influence state or national law or international consciousness? Because it's going to take an international policy and commitment in the end. And we have enough trouble with certain national governments. And one that just came to mind was when you were talking about these various, like asthma and so on, is a denial that, what is it, the P2 particle, the dust particle that is ubiquitous and has so much to do with much of the asthma and so on.
Yeah, yeah.
It's being denied.
Yeah. Well, two reactions to that is that,
Yes, sir.
I do think that we are translators in this work. And a lot of
Yes.
this is confusing. It's, we are trained to understand the science of this. We are
Right.
scientists and we have a lot of integrity, whether it's talking about COVID, whether it's talking about asthma, whether it's
Right.
talking about climate change. We are trained to understand how to study this science and to
Yeah.
explain why it matters. And so we need to learn how to enter the public forum and be able to explain this to the general public so that, for example, people understand why it's going to be so important to take
Yes.
vaccines when there's one for COVID, or that, air pollution, this particulate matter 2.5, how it's impacting people's lungs so that children are going to the hospital more. So there's a translational role. And then as an educator, a lot of our focus has been to work on projects with our students
Mhm.
so that they can get involved. And so my background's in global health and human rights, and I really like, thinking about the
Mhm.
global sphere. But I think also for students, a lot of times we want to have them understand how a lot of these issues are impacting their direct community and the community that their patients live in. And so this is an opportunity for them to work on projects and understand what's happening, right around I work in a community health center, and what are the issues going on right around that community health center that are impacting our patients. And so often we stay quite local so that our students, as they're taking care of patients in the clinic, are also able to kind of get to understand the town and the community that they're working in,
Yes.
and what are the kind of active issues that are nonprofits and things like that are working on. And it's a way for them to connect with, their work and to understand, where their patients are coming from and what issues are really impacting their communities.
Yes, this is really wonderful. I just hope this will really go forward. And that, do you see it, before we close, do you see it spreading to other medical schools and facilities? There is definitely.
I am seeing, I think this is growing. I think,
Oh,
again,
that's great.
students and residents are asking for it. And now it's to the
Yeah,
point where, if you don't have clear plans and showing, how we can engage with issues of equity, people aren't going to want to work there and people aren't going to want to
right,
train there because
right.
people are having an increasing awareness of how important it is to understand these issues as a part of being a good doctor.
Yeah,
To be a trustworthy doctor, a well-informed doctor, a robust and a rigorous doctor, you got to have some training in this, and people will go in various ways in their career of what it means to them. I don't have any, firm picture of I want people to do this or that with them. I want
right.
people to figure out what it means to them. But we have a responsibility to be training our residents and students about this stuff so that they can figure out what it means to them.
Yeah, that is just great. It's just uplifting right
Mhm.
now to hear this kind of commitment from the medical community. And certainly it's encouraging to hear that the medical students are really behind this. They understand the big picture and they're very committed to changing it. And I think also they might have more of a worldview, an international view. That today we are an international community. That's the default setting. And so
Yep.
we have to operate together. We have to help each other. But this is so encouraging. And I really appreciate your giving your time and information for us like this. I wish you the very best and hope to hear from you again.
Thank you so much, and thank you for allowing me to join. And yeah, I think
Yes.
together we can really try to build a
Yes.
healthcare
Oh, I'm going to be back in touch. Don't worry.
future. Thank
Thank
you.
you ever so much. You were most kind to give us this great information. Good luck. Bye bye.
Thank you, Yvonne.